Welcome to the NursiConnect Podcast. My name is Ava. I'm the Chief Executive and founder of the remote nurse staffing agency, NursiConnect. And on this podcast, we talk about all things remote nursing. And today, you guessed it, again, we're talking about inpatient virtual nursing. It's my absolute favorite. I don't care what nobody else has to say about it. But today, we do have a guest. She is an inpatient virtual nurse herself. I'm going to let her come on and introduce herself. Hello, Miss Emily.
Hey, Ava, thank you so much for having me. I'm really excited to be here and be with you guys.
Yes, thank you so much for coming on the show. Let's get right into the interview. So can you tell us a little bit about your nursing journey from start to finish, kind of your story?
Sure. So to be honest, I really had no intentions of becoming a nurse. Right out of high school, I was really uncertain about the career path that I wanted to take. I went to college, changed my major probably 4 or 5 times, but each time it was in the healthcare field. So I knew I at least wanted to do something in the healthcare field. My nursing journey really wasn't sparked by any glamorous aha moment. It actually started with my mom's observation. She kind of thought that my interest in all things related to health and science, along with my love to be social and care for people, would make me a great nurse. So I trusted her judgment, explored the field, and here I am. I spent 9 years working in emergency medicine and a brief year in labor and delivery, which I found out really quick was not the area of nursing for me. I've been a virtual nurse for 4 years now, and I really just love it. I've had the opportunity to do inpatient virtual nursing, a hospital at home, virtual nursing education, and work with the MSNCB to help create the Cavern exam that was recently released.
Yes, oh my gosh, I love it. 4 years as a virtual nurse. And let's back it up a little bit. Let's talk about, well, in this episode, we're going to talk about inpatient virtual nursing. So for all of our people listening, can you kind of describe what that role is, inpatient virtual nursing?
Yeah, so inpatient virtual nursing, the way I kind of try to describe it to people is it's really meant to complement a bedside nurse. I see a lot of misconceptions that virtual nurses are trying to take over bedside nurse positions, and that's just not the case. And so virtual nursing is really just an innovative approach to providing care for patients. Being able to help these bedside staff offload some of those tedious tasks and being able to provide an extra set of hands for these nurses.
Yeah, I'm practicing as an inpatient virtual nurse right now too. So yeah, I definitely agree with Emily's definition of inpatient virtual nursing. There's a lot of other misconceptions that I feel like I hear as well. Another one is the increased ratios on the floor for the nurse. If they have a virtual nurse. Now, in some literature, I've read the ratio for the virtual nurse, just the one virtual nurse, is like 1 to 20, 1 to 24, just how many, how many patients are the unit. Usually that's what the virtual nurse is assigned. And because that is true, now people are saying that because they have a virtual nurse, now they're going to have more patients as the in-person nurse. So usually virtual nurses are seen, well, I've been practicing in the med-surg area, high turnover area for nurses, and usually they usually have anywhere between 4 to 5 patients, sometimes 6. I don't know. Lee, have you seen that, the virtual nurse coming in and then the nurses on the floor having more patients?
I have not seen that. I've worked for 2 different organizations doing inpatient virtual nursing and have not seen that. So definitely, I'm sure there are some hospitals that are using that practice, but I don't think that it's very common. So you're absolutely correct. It's definitely a misconception that I think we need to dispel about what virtual nursing is and how we can help.
Right. Yeah, I have not seen that either. And I've practiced virtual nursing across 5 hospitals now, almost 6, but it definitely is a topic of discussion. And a lot of the concerns, well, a main concern for the bedside nurses working on the floor. And I agree, it would be a concern of mine too. I would not put it past hospital administration to try to do that to them, but
No.
that is one of the misconceptions. Now, Emily, can you tell us a little bit how you got into inpatient virtual nursing? How did you find out about it? How did you get the role?
Yeah. So I found out about virtual nursing during the COVID pandemic when remote healthcare was becoming a lot more prevalent because people didn't want to go into doctors' offices and hospitals. So they were trying to find alternative ways to see these patients. Now, virtual nursing has been around for a long time, but it just kind of became more prevalent with the pandemic. I didn't really know much about virtual nursing at that time. I just knew that I was really unhappy with my current role at that time due to workplace bullies and a patient population that I didn't really connect with. And I also had some restrictions due to a spinal injury. So, despite knowing nothing about the scope, virtual nursing seemed like a good fit for me, kind of offering that fresh start and being able to work remotely. I had spent probably hundreds of hours online researching jobs and companies that offered remote positions and just started applying. I filled out so many applications. Let's just say if I had $1 for every application I filled out, I'd probably be able to retire now and fulfill my dream of living in Europe.
Yeah, virtual nursing, I would say similarly, I found it after the pandemic, during the pandemic. 2022 is when I started doing virtual nursing. And I did not fully understand the job description. Like you said, I didn't understand, the scope. But once I started doing it, I absolutely loved it. I was like, oh my gosh, what are nurses doing from home now? We're doing what
Mm-hmm.
now? It was when they called me to sign off on a heparin drip. And I was like, no way. There's no way the virtual nurse can do that. And the preceptor, she goes in the room, she shows me, how to use the camera, how to sign off, how to do all those things. And I'm like, this is for real. Virtual nursing is for real.
It's amazing. It's
Uh,
opened up a lot of opportunities.
yeah.
I
So
don't want to go back to bedside.
I know. I fell in love with it. I have not been back to bedside nurse. I left bedside nursing 2 years ago because you're
Same.
essentially still at the bedside in a way. You just don't have to deal with being in person. Like you don't have to
Mm-hmm.
gown up. You don't have to put on PPE for certain patients. You don't have to commute. Oh, did we tell y'all it's still 312s? Yep. We work
Mm-hmm.
from home 3 days a week. They offer day shift and night shift, and I see they offer some mid shift positions too. Sometimes you work from 10 to 10, 8 to 8. But yeah, virtual nursing, it just seems like a good solution to what it was designed for, which is to try to retain nurses at the bed.
Absolutely.
So
Yeah, absolutely. And
yeah.
I think it's going to really, it's going to become even more popular over the coming years once it's really understood.
So can you
Okay.
kind of go over like a day in the life of inpatient virtual nurse, what your shift looks
Yeah.
like from start to finish?
Yeah. So when I was working as an inpatient virtual nurse, my day was organized a little bit differently than it is now. A typical day as an inpatient nurse for me involved logging into all of our telehealth systems, reviewing charts, conducting virtual rounds, and coordinating care with the on-site staff. Unlike the bedside nursing, virtual nurses don't perform physical tasks but focus on communication, monitoring, and patient education. As an inpatient nurse, virtual nurse, you will be reviewing charts for completion, ensuring all patients have required admission documents, that their medication reconciliations are complete. You will review bundles that can be directly tied to reimbursement, like sepsis and stroke. And in this virtual nursing role, you'll be providing discharge education to patients, discussing their diagnosis, treatment plans, their follow up appointments, and new medications. And then you'll also, during your shift, be watching patients' vital signs and trends for any signs of deterioration. And in my experience, I've had patients in every area from the ICU to step down, med surge, pre-op, L&D. The opportunity to utilize virtual nurses can be found in nearly every nursing department in the hospital.
Now, what were your hours like? Did you work day shift, night shift?
I work day shift, usually 7 to 7.
Yes, team day shift. I love day shift. I did work a few shifts, night shifts as an inpatient virtual nurse. I was fighting to stay awake. I just could
Mm-hmm.
not.
I saw that recently on your TikTok.
Yes, I was like, oh my gosh, like what in the world?
Yeah,
It's a little bit slower at night, nobody's getting
sure.
discharged at night. The first 4 hours it was busy because right at shift change, it's like every hospital, there's admissions coming up to the floor from the emergency room. There's admissions waiting. So those patients are coming in, and then up until like maybe 11, 12 o'clock, midnight, you're like, okay, it's calmed down a little bit. And then you might get another admission like 2 a.m., maybe one more at 3. And then that's your
Yeah.
shift.
My first virtual nursing position, we were originally offering services until about 2 a.m. and we were finding that the utilization was not quite where they needed it to be. So they cut it back to 11 p.m. And then the same thing with my second role, we only did till 11 p.m. because those were our prime hours that we were being utilized. So they didn't even have a full night position, maybe more of an evening, but not a full nights.
Yeah, I find that a little bit too. But I just interviewed another virtual nurse, a night shift virtual nurse, and she said she works the full shift from 7 p.m. to 7 a.m. She said they use them pretty much the whole night, med sign offs, skin checks, things like that. So, but I can imagine trying to do a med sign off being that sleepy. But
well, and two, I think that's a great resource, especially for nights, because I know when I worked nights, it could be impossible to find somebody to help you co-sign, or if you had a question, just trying to find somebody else on the unit could be a struggle. So I definitely see how the virtual nurse could benefit both days and nights.
oh yeah, absolutely. And I even had a patient the other day. I was doing her discharge, and she was like, the whole time we've been in the hospital, I've been trying to understand why y'all have virtual nurses. And she said this is our second hospital stay with virtual nursing. And she said, I noticed the nurses are happier on the unit with virtual nurses. She said, y'all are doing something. She said, I don't understand it, but something's going on. They seem to enjoy working with you all. When I asked them, she was like, so I hope you guys continue to do this. And I was like, yeah, virtual nursing is a little different. There's a camera in the room. I usually tell patients that it's like a FaceTime call with your nurse in the middle of the hospital room. So yeah, it's something that's definitely evolving and trying to take its form.
And it's so important to educate both the patient and the bedside nurse about what virtual nursing is. And I can say that because I experienced firsthand the first organization that I worked with, that program was cut. And I wholeheartedly believe that it was cut because it wasn't being utilized to its full potential. Because I don't think that the nurses on the floor truly understood what a virtual nurse was. And so we were, finding that our utilization rates were not where they should be. So educating these bedside nurses on the equipment, basic troubleshooting with the equipment, whether you have hardwired technology or carts, tablets, whatever the case may be, that they have some teaching on the basic technology, and then knowing the full scope of a virtual nurse so they know where we can assist them and where we cannot. And then too, like you mentioned with the patient, just educating the patient on why they're doing it. Most patients that I've had have been wonderful and very open to the idea of virtual nursing, especially once it's explained to them. So it's really important to make sure that you educate your patient as well on the benefits of it and why we're there. And that it's not just to help the bedside nurse, but it's to help the patient as well and make sure that they get that good comprehensive care.
Yeah, I will say my patients, they do ask me kind of on a regular basis, am I AI when I come up on the
Yes.
screen?
Yes. Yes.
Them,
All the time. All the
no,
time.
no, I am not. I am a registered nurse. I'm a real person. If you can see me, you can touch me, feel me. I'm a real person. I'm a real nurse. I'm just on the TV right now. I'm like,
Yes.
I tell them, I'm like behind the scenes, doing your vitals. I mean, watching your vital signs, collecting information. I tell them, like, you have two nurses. You have one in person, and then you have another one virtually. That's like the best way I can explain it for them.
Mm-hmm. And most of them are really appreciative when they get that explanation, and that they can have kind of that instant connection with a virtual nurse if they need. Finding a lot of times at discharge, patients are even more grateful for it because we can help move things along a little bit quicker for them. And we can really dedicate that one-on-one time with patients which I've seen in all of my positions, whether it was inpatient or whether it's hospital at home or the hotline, that the patients love to just have those conversations with you that they don't always get with the bedside nurses because they are so go 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 and so busy. So it just gives them a little more an intimate feel, and they are very appreciative of that.
Yeah, I'm glad you brought up the one-on-one time, especially at discharge, because the other day I had a Spanish speaking patient, newly diagnosed with diabetes. The diabetes educator did come by to see him, but that discharge took about 45 minutes,
Yeah.
just because of the language barrier and the new diagnosis. And he was actually engaging with me, asking me questions about his
Mm-hmm.
diabetes. He was like, "Oh, what's insulin? Oh, how often do I have to take it?" So I was glad to have that one-on-one time, because I was like, okay, he obviously needed, because the diabetes educator did come, but it just didn't connect, I guess, the first time. So now we're going back through the information, 45 minutes, and he was able to really engage and ask me the questions that he needed about his diagnosis. And I
Mm-hmm.
felt good about that. I did not feel rushed. I mean, the virtual nurse has other tasks to do, but nobody's going to die if you don't do the admission right when it comes to doing it. Like, it can,
Right.
you know what I'm saying? So, yeah, I
And
really,
it's so important to go over all of that information at discharge, their new medications or medication changes or their follow up appointments and things like that, because it really is directly tied to um, reducing readmissions. And so that bedside nurse, you just saved that bedside nurse 45 minutes that, that they wouldn't have had time to sit there and do that. So it's so important to be able to provide that one-on-one interaction with your patients.
yeah, definitely, definitely. Now, as we continue to talk about virtual nursing, let's talk about your work-life balance and how it's
Mhm.
impacted you as a nurse. Let's talk about it from the nurse perspective. Let's talk about nurse satisfaction. So, how has virtual or inpatient virtual nursing impacted your work-life balance?
Oh, it's night and day difference. Working remotely has just significantly improved my work-life balance. As we mentioned earlier, the commute, I've saved time by commuting. Where I live currently, we only live about 25 miles from the nearest hospital, but with traffic, it can sometimes take an hour and a half to get one way. So not having to commute gives me some more flexibility, kind of manage my personal and professional responsibilities. And I would just say my mental health overall has improved so much. I really do feel like a new person. A recent study showed that 83% of employees believe that working from home has improved their mental health. And I'd absolutely agree with that 100%. And also, I'm more willing to pick up extra shifts to help out. If there's somebody that calls in last minute, I don't mind just jumping on and helping cover because I'm not as mentally and physically drained as I was when I worked bedside. So it's changed so much.
I'm glad you talked about picking up shifts, because that kind of leads into the next thing. Let's talk about pay. How was your pay impacted working as a remote nurse?
So I'm very fortunate that I actually was able to make more as a virtual nurse than I was at bedside. I know that that's not the case everywhere. I see a lot of posts on, if I'm looking at LinkedIn and things like that, that the pay is not where I feel like it should be, because we are still providing nursing services. I think some companies do like to reduce the pay just a little bit because you are working remotely.
Yeah, I'm on the other end. Well, I'm already a nurse in the South in North Carolina. So when I was working at the bedside, I was making $35. I was a float pool nurse. But I was so tired of working at the bedside. When I saw the opportunity to make $32, I was like, working from home, I was like, okay, you know
Mhm.
what? I'll take a little bit of a pay cut if I don't have to pay for gas, pay for parking,
Mhm.
and pay for childcare.
Mhm.
Now there are shift differentials available for the virtual nurse. Where I'm at right now, it's only like $2 or $3 for the differential. I don't know. Have you experienced having a differential as a virtual
Yeah,
nurse?
yeah. I've seen differentials with evening night shift and also weekend as well. The weekend's really where it kind of weekend nights is really where it starts to add up and be be a lot more incentive to pick up those shifts.
Yeah, exactly. And like you said, picking up those shifts remotely isn't as, I guess, inconvenient as having to commute to the hospital, go pick up the shift when you can just, the charge nurse send out a message, hey, anybody want to pick up on Saturday? And some places let you pick up or pick the hours that you want to work if they need assistance. So let's say they have admissions and discharges that are heavier between 8 and 1. They just want a virtual nurse to come in from 8 to 1 and not
Mm-hmm.
12 if they're not needed. So it's very flexible in that regard. And you can still, make your shifts, get your overtime, time and a half, make your money.
Exactly.
Oh, Emily, do you have kids?
I've got 2 stepkids, yes.
Okay, let's shift gears a little bit. Let's talk about motherhood and remote nursing because that's a big
Oh boy.
topic.
Okay.
So nursing being a female dominated profession, a lot of us are mothers. And the biggest thing I get on TikTok when I post my day in the life vlogs is, how do you care for your young one when you're working remotely full time? And the answer is, I don't. I use my family. I'm very close with my family. And they come in on the days that I work. Because I work 3 days a week and not 5. It's a little bit more flexible. But Emily, what are your thoughts on that? How is your motherhood situation with virtual nursing?
So my kids are a little bit older. I've got a 17-year-old and a 14. So they're very self-sufficient and can kind of take care of themselves. I do find them kind of wandering in here, wanting attention, every once in a while. But I have worked with many, many coworkers who have had young children, and it is definitely advised to have somebody else with you to take care of the kids, because you can't be on a call with a patient and a screaming kid in the background. I see a lot of posts on remote websites where people are wanting remote jobs, specifically not for the daycare situation. And every company is a little bit different in their approach with the work-life balance. Some companies don't mind at all if you need to leave for an hour to go pick up your kid from school or to take them to an appointment. They have that flexibility. But in my experience, they definitely have had to find some alternative options with childcare.
Yeah, I have a 2-year-old, so my kid is not self-sufficient like Emily.
Mm-hmm.
I wish, but yeah.
Will
So
be
she,
eventually.
what'd you say? Really?
She will be eventually.
Oh my gosh, yeah. So 2-year-old, and I only have one child, so it kind of works a little bit. But what did you say, Emily? You said I was gonna piggyback off of it. Oh yeah, Emily did mention that some companies are flexible about the child care situation. Like one time my daughter, she woke up with a fever 105 and I was working. And y'all know, as a nurse, I wanted to take her to the emergency room. But I ended up taking her to see her PCP first because that's what the nurse told me to do. But I was working and I just messaged my charge nurse. I was like, hey, I need to step away for about an hour or two. I need to take my daughter to the doctor right now. And I was able to step away, take her to the doctor, came back a few hours later. She was fine. Thank God. And then come back and pick up the work that I was doing. I was very grateful that they were understanding the situation and kind of let me finish getting my hours for the day. So like she said, some companies are like, yeah, and then some companies are like, well, you need to figure it out. So
And
but,
back to where we were talking earlier about picking up extra shifts, working remotely as a virtual nurse, I have never, not once, been to the point where I've not had somebody willing to cover for me if I needed to take a day off to go to my son's lacrosse game, or if I needed to do something with him for after school. Because people are more willing to help out when they're not so mentally and physically drained. So that's been one blessing, is I'm always have somebody that's willing to help and cover.
yeah, that is awesome. When nurses are happy, I'm trying to tell you, it's a trickle down effect. Like,
Mhm.
I know I'm probably going to get dragged for saying this, but in my opinion, like if the nurse satisfaction is above the patient satisfaction, because if the nurse is not happy, the quality of care is not that great.
Yeah.
Co-worker connections are not great. So if the nurse is not satisfied with what they're doing, it's a problem. But I think virtual nursing,
You're right. It's going to trickle to the patients.
yeah,
Happy nurses are equal happy patients.
Exactly. All right. So let's talk about the next hottest topic in remote nursing. All on my TikTok and my comments, nurses always say your nursing skills. What about your nursing skills? How do you feel about losing your nursing skills? And personally, I feel like I'm going to be the best virtual nurse you've ever seen in your
Hmm.
life. And I'm going to do
Hmm.
all the things you need me to do. I don't know, Emily, how do you feel about nursing skills? What does that
It's a
comment mean to you?
it's a different skill. So while working remotely, we are not doing in-person tasks like IVs or Foley's. We're really honing other skills like our communication, being able to communicate effectively and think critically without relying on physical assessments. I can definitely say I've become more proficient with technology too, my time management and prioritizing tasks independently without having supervision that you would in a hospital setting. And the biggest thing, I've really just been able to expand my knowledge base in general because as a virtual nurse, we can provide e consultation, which is a service that nurses in the hospital can use to ask questions about a policy or a procedure or maybe an intervention for a patient. And we can provide them with the guidance and resources for that. So it's really important to be able to have a wide range of knowledge to be able to do that accurately.
The e-consultation, I have not heard of that yet in virtual nursing. I've heard of mentorship, but like
Mhm.
it just seems like it's if you and the nurse are in the room at the same time, they have a question. But I didn't know it was designed to where the nurse can specifically ask the virtual nurse.
Yeah, I
Um,
think every hospital or every organization is going to have a little different intake on it. For the first hospital that I worked with, yeah, we did this on demand a mentoringship sort of thing. I guess it is a version of mentoringship, just a e-consult where if a nurse had a question about they were filling one that I can specifically remember was a question about filling out an MRI form, and then another one was a question about the blood administration policy. They were both new nurses, could not find anybody on their unit at that time that they needed the assistance right then and there. So they used their phone a friend option and called the virtual nurse. And I think it's a really great option if it's utilized to its full potential, because the turnover rate with bedside staff is just incredible right now. And there are a lot of new graduates coming in, some that were taught and trained during COVID. And so they didn't even maybe get a clinical semester, these clinical semesters in college, and that hands on experience. So they're coming into this without having that full, nursing education that most of us get. So I really think that having that consultation service is wonderful. And so while you're losing those skills to do IVs and Foley's, you're developing a whole nother set of skills that's really beneficial.
yeah, I like to tell people I'm honing in on my soft skills in nursing,
Yes.
my soft
Yeah.
nursing era right now.
Yes.
So
I've done my time.
yeah, leave me alone. This is my soft girl era right now. Okay, let's wrap up the interview. So, I want to ask you, what is the best part of being a nurse for you right now? You're in your nursing career, or at this point in your career, what's the best part of being a nurse for you right now?
So in the past, I would have been like, working in the ER. I had the opportunity to really make a direct impact on someone's life during that critical moment. I saw some really cool, interesting, and bizarre things to say the least. But that focus has really shifted now to the virtual nursing role, and I'm just so passionate about it. And the best part of being a virtual nurse is because we're at the forefront of an emerging field that's really shaping the future of healthcare. I'm passionate about the role that I've been able to have with virtual nursing, kind of helping establish these standards for virtual nursing and helping to educate others about virtual nursing. I worked bedside for a long time, and having been in the shoes of traditional nurses, I really understand the challenges that they face, especially with those time consuming tasks like charting admissions and med recs, which are my least favorite, by the way. So I know firsthand how valuable nursing support can be. And I would have given anything to have that kind of assistance when I worked bedside. So I feel like I can really make a difference now by leveraging technology, to be able able to support my colleagues and ultimately improve patient care. And it's just really been incredibly fulfilling to be part of this innovative approach to nursing.
Yeah, I agree. Virtual nursing, it has a unique aspect to where if you're practicing as the virtual nurse, you've been the bedside nurse and you're now practicing as the virtual nurse, so you know what it's like to be them. So the work that you do is just it fulfills them and it also fulfills the patient, you know. So it's
Mm-hmm.
I like to think it's unique. Virtual nursing is unique in that, right? It's not many roles where you can be the nurse that's also supporting the nurse and taking care of the patient.
Agreed.
So
And to that aspect, I would say that one of the skills that a virtual nurse needs to have is that they need to have, at least in my experience, that they need to have that in-person experience, because with any nursing career, there's those core attributes that that we need to have, and a solid foundation with clinical knowledge and experience, I think, is really important in order to be able to transition to not seeing these patients in person, being able to provide education, and being able to watch these trends remotely on your patient and watch for these signs of maybe deterioration and picking up on those cues. And if you don't have that bedside experience, you may not be able to pick up on those things.
yeah, I totally agree with you on that. Lastly, what would you say to all the nurses who are aspiring to work from home or to get into virtual nursing? What would you say to all the nurses listening right now?
Really embrace technology and continuously try to improve those technical skills. The job isn't the most suited for people who struggle with technology because it is so dependent on technology, and you don't have an IT person remotely with you to help navigate those issues. Being able to develop those strong communication skills and adapting to new workflows. Do your research, look for companies that specialize in telehealth, remote patient monitoring, and virtual care, and using those keywords in your searches for these positions. Network with other virtual nurses through organizations, forums, and social media, and just really stay persistent. For the position that we recently hired, I think there were over 400 applications. Everybody is really interested in this, remote field. So just keep applying, stay positive, and try to find ways to make yourself stand out from the other applicants.
Emily, do you have any additional thoughts that you would like to share? Anything you want to promote? Do you have anything going on?
Yeah, so I have recently partnered with a major licensing company to, we are kind of creating a test prep committee for that cavern exam that we talked about earlier, which is the certified acute virtual registered nursing exam. And it's kind of just helping to create standardization across the field, and get a good credential licensing for these virtual nurses. So we are in the beginning stages of kind of creating that test prep committee, which is really going to kind of enhance those resources for virtual nurses. Think of it like when you took the NCLEX, you had all of these study materials and practice test questions and things like that. So that'll be in the development eventually. I was recently just featured on the Monitor, which is the Academy of Med-Surg Nurses digital content destination. We had an episode on there that focused primarily on virtual nursing and the cavern exam. And they will also be posting an article that I wrote called From Bedpans to Bandwidth, Adventures in Virtual Nursing, kind of exploring virtual nursing a little more in depth. And so I'm just really committed to kind of spreading knowledge about virtual nursing through my LinkedIn platform. So feel free to connect with me on there for some updates and insights. So my name is Emily Schmidt. You can find me on there. And my title will show that I'm a certified acute virtual registered nurse and virtual nurse educator. So I'd be happy to communicate with everybody on there.
Oh my gosh, bedpan to bandwidth. That need to be on a
Yeah.
shirt. That is hilarious.
There's so many opportunities for that title.
Oh my gosh, bedpans. I mean, it's a bedpan, just
Yeah. Yeah, it's a big difference. But yeah, there's a lot of opportunities with that title. I was pretty impressed with myself, honestly, for coming up with that.
Bandwidth. Okay. All right, you guys. Again, my name is Ava. I am the Chief Executive and founder of the remote nurse staffing agency, NursiConnect. We are looking to place inpatient virtual nurses, remote nurse case managers, and psychiatric nurse practitioners. NursiConnect just became a continuing education provider, so we will be offering training on virtual nursing. That training will be available August 1st. So kind of similar to what Emily was saying about the prep, but my course is just going to tell you exactly what to expect your first day at work as an inpatient virtual nurse, what you can expect, the technology you'll interact with. So that, of course, will be available, and you'll be awarded one continuing education credit for it, just one, but that'll be available on our website. You can also sign up for the course on our email list. I'll link the email list description in the, what's it called on the podcast? The podcast notes. And I'll also link Emily's information too in the podcast notes, so you guys can know exactly where to find her. All right, you guys, thanks so much for tuning in. Emily, thank you so much for being a guest on the show.
Thank you so much for having me. It's been quite an honor. I love virtual nursing. I love talking about it. So anytime you want to chat, send me a message and we'll talk about it.
All right, y'all. Thanks for listening. Come back for the next one.